Predictors and correlates of lifetime and persistent non-suicidal self-injury and suicide attempts among adult survivors of childhood sexual abuse. Childhood sexual abuse is a well-established risk factor for non-suicidal self-injury and suicide attempts. Still, few studies have examined predictors of individual differences in non-suicidal self-injury or suicide attempts amongst childhood sexual abuse survivors. To date, no study comprehensively examined the role of abuse and perpetrator characteristics, cumulative childhood maltreatment, and other factors as predictors of lifetime non-suicidal self-injury and suicide attempts. To address these literature gaps, the present study utilized a unique sample of adult childhood sexual abuse survivors recruited from support centers for sexual abuse survivors in Norway. The scientists used the following methods to investigate the problem. Procedure. Support centers for sexual abuse survivors provide low threshold health in terms of information for individual consultation, support groups, talks, and social events. Definition of childhood sexual abuse. Sexual abuse was defined according to the Norwegian Criminal Code, which distinguished between sexual abuse behaviors, acts, and intercourse. During the study of the problem, the following aspects were touched upon: characteristics of the abuse and perpetrator, cumulative childhood maltreatment, types of childhood maltreatment, physical, emotional, and sexual abuse, post-traumatic stress symptoms, anxiety and depression symptoms, insomnia symptoms, nightmare distress, eating disorder symptoms. Relation problems were assisted by 5 items: strongly disagree, disagree, neither disagreeing nor agreeing, agree, and strongly agree. Perceive social support. After conducting a survey, testing, and analyzing the data, the scientists were able to draw the following conclusions. Findings indicate that previous suicidal attempts, cumulative childhood maltreatment, violent abuse, severity of mental health symptoms, relation problems, and lower perceived social support levels may be risk factors for future suicide attempts among adult childhood sexual abuse survivors. Present research has been made possible by funding by the Norwegian Dam Foundation, the Norwegian Council of Mental Health, the University of Bergen, and the Melger Foundation.